30-year-old female came for NT scan at 12 weeks. You can see the still images in the video and give the diagnosis. The still images might mislead you, but the video is very helpful and so you can pass the video if needed for the diagnosis. If you want more time, please review again. Within few seconds, we will discuss about the findings and the diagnosis. Are you ready? Let's go. The images and the video show two different twins. One looks normal sonographically with its CRL of 6 centimeters corresponding to 12 weeks 3 days. The other twin looks odd with absence of the head and upper limbs. It also shows severe head drops around it. Its CRL including the head drops measures 3.3 centimeters corresponding to 10 weeks 1 day. Both the fetuses are separated by separate amnion. Both the twins show two umbilical arteries. The normal fetus shows normal nuchal translucency and nasal bone and the ductus venosus. However, the abnormal hydropic fetus shows filamentous insertion of the card. There is a single placenta which could be noted in the video. The diagnosis is TRAP sequence, which means twin reversed arterial perfusion sequence. It's a very rare complication of monochorionic twins which can be diamniotic in 75% of the cases and monoamniotic in 25% of the cases. The near normal twin can be called as the pump twin or donor twin. Even in the near normal twin, 5 to 10% might be abnormal genetically. The other abnormal twin is called as acardiac twin and it is alive and is parasitic with a supply from the pump twin. Usually in all the twins it is common at the placenta level to have arterial anastomosis, arterial to venous anastomosis and venous to venous anastomosis with normal flow in the appropriate umbilical arteries and veins of the twins. But in this TRAP sequence, there is reversed umbilical arterial flow in the acardiac twin. I repeat, usually in all the twins it is common at the placenta level to have arterial to arterial anastomosis, arterial to venous anastomosis and venous to venous anastomosis. That's common with normal flow in the appropriate umbilical arteries and veins of the twins. But in this TRAP sequence, there is reversed umbilical arterial flow in the acardiac twin. For an example, if the reversed umbilical arterial flow is significantly diminished naturally, then the acardiac fetus may not survive and may vanish. That could be part of vanishing twin or fetus papresia. I think everybody would have seen one or more cases of vanishing twin or fetus papresia in your practice. Remember, it is the same mechanism in TRAP sequence with somewhat preservation of the reversed arterial perfusion in the TRAP sequence. That's why we have pumping normal fetus with dependent acardiac twin. There are 4 morphologic patterns in the acardiac twins. First one is the most common, which is acardias acephalus, 75%, which is that's our case. Second one is less common, is acardias amorphous, which is 15% with amorphous mass of head and chest only. Then the third one is uncommon, which is called as acardias anceps, which is about 8 to 9% with amorphous mass of head, chest and abdomen. And the fourth one, acardias acharmus, 1%, which is the rarest, which shows highly amorphous pattern fully with somewhat recognition of the wider crown part. Now we will go to the prognosis. 35% have no difficulties till delivery to have a normal baby and very odd amorphous acrania. That's why repeat scan might be needed once or twice a month for that. 35 to 50% have abnormal TRAP sequence affecting the normal baby where we have to intervene for the outcome of the normal baby. We have to wait and watch till 4th month and intervene accordingly. 10 to 30% have highly abnormal TRAP sequence demising both the twins, especially if detected too late. So early detection is crucial for the prognosis. Okay, that's end of the session. Thank you very much for your patient hearing. Dear doctors, please share this with your doctors group. Give your valuable comments and suggestions. Thank you again.